Thank you, Alison. Thank you, everyone, for coming. So I'd like to tell you a little bit about, first of all, about me, about my research program, and then why examining gender, work and health excites me, and what I think are some of the challenges. Because I haven't always done gender, work and health research. So just to tell you a little bit about myself, I'm an epidemiologist, and that is someone who looks at sort of the distribution, the causes of different diseases in the population. And as Alison said, my main interests are around work injury, return to work after work injury, and how the psychosocial work environment, which is things like job control, psychological demands, how they impact disease. And one of the reasons that I really think that work and health is a great place to integrate gender-sensitive approaches is, as some of the panellists have already said, the labour market's quite gender segregated. Often there's no biological reason why women are in certain jobs and why men are in certain jobs. So there's this large sort of gender effect happening in the workplace. And then there's also, within occupations, there are these interesting biological causes which are also going on as well. And so there are differences between sort of certain health outcomes between men and women, but there's also differences in the relationship between exposures and outcomes among men and women, which I think is really nice to examine from a gender perspective, because it doesn't really just reduce down to women's health or men's health. It sort of encompasses everything in trying to understand differences in men and women from a biological and from a social standpoint. And so, as I said, one of the areas that I'm interested in is the psychosocial work environment and how that impacts on disease. And just to give you some examples of some of the challenges in that particular area. So the psychosocial work environment, usually we use a tool which was developed back in 1979, predominantly in a manufacturing environment, so particularly among males. The whole theory behind how the psychosocial work environment impacts on health outcomes is actually done predominantly on male rats as well. And so we don't really have a good understanding from a gender perspective if the psychosocial work environment should affect men and women in the same way. And so some of the work which we've done has found that things like low job control can impact or tend to impact outcomes such as hypertension to a greater extent among men than they do among women. And, we sort of put that down to the fact that, we're using instruments which were designed for men, and the whole theory behind why we think the psychosocial work environment impacts hypertension is based on male models, and maybe it's just not as relevant for females, or this model doesn't work as well among women as it does among men. But then we also found that low job control impacts diabetes much more among women than it does among men, which sort of flips it on its head. So there's a lot of things there which we can get into further about. Well, why would one exposure cause one outcome, hypertension, more among men than among women, but the same exposure results in more diabetes among women than among men, even though we also know that diabetes and hypertension are related? So that's one of the areas which I'll be looking at over the next couple of years to sort of find out a little bit more. And so, as Alison mentioned before, some of the challenges I think about at the moment are around the methods, how we integrate gender and sex into our analyses. I think we know a lot more theoretically about why it's important to do it than we know practically about how this would be done, and I'm speaking here mainly from a quantitative viewpoint. And I think there's also challenges around, so from a methodological perspective, and I would count myself in this number, many researchers just simply want to stratify their analyses by gender. So we'll do a separate analysis for men and women. But often we don't really have a good understanding of why we're doing that, what we're hoping to find, or even how to analyse a stratified analysis. So if you find that something's statistically significant among men but not among women, is that an important difference, or is it not an important difference? And obviously often it's not, but because we've stratified from the get-go, we tend to sort of land on these things. I think there is a need to encourage more researchers to integrate gender and sex into their analyses, and I think it's important for a couple of reasons. One, I think, as we sort of said, it is important to know when outcomes differ for men and women, when the relationship between an exposure and an outcome differs for men and women. But I also think it's really important to know when it doesn't. So when don't we need gender-sensitive policies and procedures? What are the situations where men and women actually have very similar outcomes or very similar relationships? And that can only be understood if gender's considered. So it may not always be relevant, but it always should be considered. And so I think those types of things are the things which I'm working on, and I'm Looking forward to answering any questions that I can as we proceed forward. Thank you.